Okay, good morning, everyone, and welcome to today's webinar, jointly hosted by Disaster Recovery Institute Canada and the Canadian Journal of Emergency Management. We're delighted to have you join us as we delve into the critical implications of emergency management and disaster response. We do apologize for the technical issues, but in the spirit of business continuity, we are working through it in the background, and we'll be happy to have the recording going up afterwards for everyone's viewing pleasure and report analysis. So my name is Alexander Landry. I'm the Senior Manager for Strategic Implementation with the Canadian Journal of Emergency Management, and I also sit on the Board of Directors for DRI Canada. It's a pleasure to be with you all today as your moderator, both for this morning's English panel and for the panel this afternoon, qui sera passé en français. So over the past many months, the Canadian Journal of Emergency Management has been working diligently on a project with DND through the Mobilizing Insights in Defense and Security program, otherwise known as MINDS. So this is our third webinar in a series of events, and we're privileged today to be sharing this platform with DRI Canada. Our focus today is really going to be on the intersections of resilience viewed through the lens of emergency management and disaster recovery. So we've gathered a distinguished panel of experts here who will share their valuable insights, experiences, and strategies. Their contributions will enhance our collective understanding and preparedness in the face of emergencies and disasters and form the basis of what will become later on interim reports provided both to DND and published at large for the Canadian community. I'm happy to be joined this morning by Dr. Michel Doré, Dr. Jeff Donaldson, Ernie Polsom, and Pascal Rodier. We believe that through collaboration and the exchange of knowledge, we can strengthen our communities and build a more resilient future. So thank you for being part of this important conversation. And at any point, you can add your questions to the chat and we'll look to answer them accordingly. This being said, let's get started and move right in. So the first thing I really want to do is provide all the speakers an opportunity to introduce themselves and ask them what their organization contributes to community resilience. That being said, I'm happy to hand it over to Jeff to kick us off.
Fantastic. Thank you very much for the invite, and it is a distinct pleasure to be here. I'm Jeff Donaldson. I'm a principal researcher at Preparedness Labs Incorporated. It's a Canadian research and education firm. I'm also associate faculty in the Royal Roads Disaster and Emergency Management program. And I'm also a 28-year veteran of the Canadian Armed Forces who has participated in many of the emergency response unit events in responding to disasters at the operational and strategic level. What my company does as a representative of the field of hundreds of entrepreneurs that exist in emergency management in Canada is that we focus on public sector resident facing preparedness communication, preparedness analytics, and building resilience at the community level. Our contribution is specifically the operationalization of the theoretical frameworks for the constituent spheres of a community, your civil, your public, your corporate, and your not-for-profit. So what we do is we translate the generalist, promotional, and often vague public programming in emergency management into specific roadmaps to employ the strategies to achieve actual success, right? We put the how into building resilience. So it's an absolute pleasure to be here with this panel and looking forward to getting into some really interesting discussions on community resilience.
Great. Thank you so much, Jeff. So Michel and I share a background with St. John Ambulance, although his experience and background and length of experience is much more in-depth than mine. We were just discussing this morning that I still fall in the youth category. But Michel, pleasure to have you aboard. Please do tell us a little bit about the organization and what you're doing here today.
Yeah, I'm Dr. Michel Doré. I'm just retired after 32 years of services with as a senior official with the Government of Canada and Government of Quebec. And I remain an associate professor with Université du Québec in Montreal with a graduate program in emergency management. And I serve as the National Emergency Management Advisor for St. John Ambulance Canada. And that's in that capacity that I'm coming on this panel today. So I'm very happy to be part of this panel and in this discussion. St. John Ambulance last year basically celebrated the origin of the movement that is 1,000 years old. We've been in Canada for 140 years. So it's a long millennium tradition of helping others in times of suffering. So in today's environment, we are all very well known for is first aid training. First aid and CPR training, and that is a significant contribution to the baseline resiliency of population in day-to-day accident as well as during disasters. First aid remained the #1 action that number one gesture or action that people can implement to save lives in time of hardness. We also have a wellness program, therapy dogs, and mental health first aid with this time of mental health issues right now around the world. It becomes increasingly helpful to sustain and develop further the resilience of population, not only in time of disasters, but also facing their daily challenges. So I'm happy to be here today to represent the NGO's contribution to the resiliency of Canada facing disaster risks.
Thank you, Michel. We are privileged to have you aboard today. So in that same vein, also somebody I know through St. John Ambulance, but also an incredibly implicated and involved member on the East Coast and the Maritimes, the Atlantic provinces. Pascal Rodier joins us today from the East. Good morning, Pascal.
Morning. Thank you. And I was just looking at the panel going, you know, Jeff is an old St. Johnner, old relatively, right? Like, I mean, we're not talking too much old, but old St. Johnner, and of course, Michel and Ernie. I don't know. I'm sure at some point you had something to do with St. John. I'm just going to guess.
I'm thinking all of my initial medical training started with St. John's.
All right. So I think once you're in that family, it's tough to leave, right? So, but I'm here representing. Really, I'm here just to speak with the panelists. I am fortunate to currently work with an amazing team that provides emergency management for a provincial healthcare organization, and that has its own dynamics, especially when we're looking at continuity of operations is obviously always in the forefront for us. So, you know, how we support the communities and the civil, you know, the citizens that we serve. So keeping our doors open is key. And how do we do that with our partners at all levels? Like Jeff said, it's not just us, it's working with our NGOs, our provincial, our federal, our local, our volunteers. So how do we continue to do that? And I have an amazing team that does that every day. But also happy to also be a part of St. John and part of working with St. John in this new movement. I think it's key to point out that as we speak right now in Newfoundland, we've got St. John volunteers working alongside other NGOs with members of the Red Cross, et cetera, that responding to the fires that are happening in that province, and they're coming from everywhere in the country, not just locals. So I just saw that on social media. So Michel, I apologize if that was going to be something you were going to do a shout out, but a huge shout out to our incredible volunteers that do this on their own time and give it themselves. So I'm excited to be here, just sort of have a chat and learn from other speakers and see where we go. Alex, thanks.
Thank you so much, Pascal. We do appreciate that. And I'm glad you do mention the fires, because that'll be evidently a relevant topic of conversation today. And it also segues into our last but not least panelist, of course, in terms of fires, Ernie Polsom, who is here. So Ernie, it's a pleasure to have you aboard. Please do tell us a little bit about yourself and your background.
Sure, thank you. It's awesome to be here. I really appreciate the opportunity. I'm 41 years into a career in fire emergency management and ambulance service provisions to municipalities from Manitoba to British Columbia. As fire chief in the city of Regina, city of Leduc, town of Tabor in Alberta, and I spent 8 years with the fire commissioner's office in the Alberta Emergency Management Agency as well. Where I met Michel, actually. So I'm now the CEO of Firewise Consulting and Learning Academy. So we do an awful lot of work with municipalities, First Nations across Canada, developing and understanding community risk and risk profiles, and linking up their capability and capacity to manage that risk, either alone with their own resources or as part of larger regional organizations and operations. So there's some pretty consistent trends right across the country. I'm looking forward to exploring them with everybody.
Great. Thank you so much, Ernie. So this is great. And as you can see, I think, right, just from the introductions, we have a lot of interconnections and essentially people that know each other from their backgrounds. And that's because it's such a small domain, small world, right? Even though it's pan-Canadian and reaches out far and wide across the nation from coast to coast to coast, We're still, a lot of people know each other, they have the backgrounds, and that just comes from working on operation zones together, working on policy in the background, or just meeting in terms of events like this, which is part of the reason we're looking to foster it today. So part of that actually calls into what the Canadian government's been looking at recently through what they've called the whole of government approach. And that kind of forms the basis a little bit for the idea of community resilience and how we're looking to move forward from simply having the panic button where the army gets called in some regards, or we have to commit higher level resources, be it from the provinces or even out of country in some regards. And that's not just limited to Canada, but internationally speaking. So starting off with Michel, I'm curious to hear what's your point of view or organizations on the whole of government approach to emergency management? Is Canada doing things the right way? What can we look to do better in that regard? I know it's a large question, so please feel free to take that from the approach you'd like to.
Well, the whole of government is an improvement from where it started back in the 50s, when the civil defense was all under the military and all the plans were secret. So shifting from that cultural tradition to the whole of government approach it has been a significant challenge within the governments, not only government of Canada, but also in the provinces where it was under the police, and with the less than perfect collaboration or coordination between law enforcement and the military then. To this day, we look at the new policies across Canada with regards to emergency management. It's more of a whole of society approach rather than all of government that is called for. This is where we're heading. So it's one thing to mobilize all communities. We're talking about First Nations, we're talking about local communities, provincial, regional governments, and provincial governments. We obviously are expecting some guidance, some policy directions from governments. But on the other hand, it's, and I'm piggybacking on Jeff's statements earlier, it's where the rubber meets the road on the ground that response and resiliency has to manifest itself. So it's within the households, it's within the communities, the businesses that we can see the resilience. Now, there's a kind of some paradoxes. There are many paradoxes in our world. One of them is somehow politically driven. It's hard to trigger an investment into disaster resiliency among citizens or within a community or organization if politically we keep on saying that we are ready, government will be able to support you, the municipality has a plan. Yeah, we all have plans, we all have capabilities. However, every time a disaster unfolds, these capacities are overwhelmed, and then the reflex comes to call upon DND, Canadian Armed Forces, to the rescue. So we are all overlooking the significant pool of resources and capability that remains at the grassroots level. And that just as a fact that has been documented in studies for many decades, in large-scale earthquakes, which is probably the most catastrophic events that could happen in any jurisdiction, most persons pulled out alive from the rubbles are more than 75% of them are pulled out of the rubbles by people that are not wearing uniforms. So it's the neighbor, it's the bystander, it's the volunteers locally, the local business, the corporate citizens that make a difference in saving lives locally. And that same type of learning is emerging from the number of terrorist attacks that happen in Europe, where we come to realize that most fatalities die from hemorrhage. Hemorrhage is something that can be controlled by basic first aid if we don't evacuate all the first aiders, the spontaneous first aiders from the impacted zone until the organized response happen, often too late to rescue anyone alive. So we have to revisit what we know, what science tells us about disasters, and stop trying to impose or force the communities or society to apply and adapt to the plan, but start revisiting the plan so they adapt to the reality of social behavior. And this is what sociology has been providing to our field over the last 70 years. So I'll stop it there.
Appreciate that, Michel. So I'll segue right over. I know Jeff probably has some comments on that.
Well, yeah, absolutely. But I just think it's important at the whole of government level to first acknowledge that Canada does have a robust and I would argue appropriate and functioning governance model for emergency management. The FPT framework that we have, including its committees and structures, are the ideal structure for a cooperative federalism negotiations that we have, being that neither level of government, provincial, territorial, or federal, has the authority to impose standards on emergency management. We don't have that kind of constitutional arrangement in this country. So you can't have a higher level of government create an agency and impose standardization. That can't work in this country. So with that, it's important to say that I'm a huge champion of the current FPT framework. I don't think it's broken. And I actually would argue that it is a great governance model, structurally built from a policy perspective, that should be replicated across the environmental movement, the natural resources movement, et cetera. So I don't think we have a structural or an organizational problem in the functioning of government. So if the different levels of government getting together are having a challenge in coming up to some standardization process, which I'm sure we'll get into later, the number of standards in Canada that are all over the map interprovincially, that's a question and a function of the humans in the room, not a function of the structure itself and the way we do that. But from a whole of government, I actually think we do this exceptionally well in Canada. And on an international comparative scale, I think we would score well against our competitors. The challenge is that we're the second largest country in the world. Our hazard and risk profile is dramatically different across the country. And I would argue, I'm in Ontario, it's 14 million people, and I don't think the government of Ontario has the horsepower, the capacity to understand the risk profile across its own province, let alone some type of national methodology of understanding a risk profile. So I really think, to amplify what Michel said, that this is really all about regionalization and not nationalization of emergency management policy oversight and cooperation and coordination. I would argue nobody really collaborates. I think that's a pretty exceptionally high standard of the communications architecture. But for coordination and cooperation, I really think this problem is best addressed at a regional level than a national level. And I'll leave that there. I've got much more to say, obviously.
It's going to come, yeah. And that's great that you mentioned that, because the regionalization versus the federalism perspective is one that's important, specifically as we've seen recently with, the Labrador fires, and we've seen the humanitarian workforce program actually come into play with SARVAC, Red Cross, St. John Ambulance, and I'm sure there's a plethora of other organizations I'm missing, but for the sake of the time, we'll, of course, move forward. So, Ernie, I'd love to hear your perspective on that and how it works really in the fire industry, but also from your experience, like what it's looked like in development over the years, from when you entered into the domain in the industry to what you're seeing today. And then I'll follow up with Pascal, because I know he's got a lot to say about the whole FEMA idea, and I always love to finish off with that one.
Thanks. Yes, I always kind of chuckle a little bit when I hear about the all of government approach, or the whole of government approach that Canada has. And we talk about federal, provincial, and territorial governments. We forget First Nation, Métis, municipal governments that are an absolute critical partner, frankly, are the front line of response. So everything that flows out of that deployment is based on the decision-making capabilities, knowledge base, and frankly, the courage of those very frontline responders. The volunteer fire chief in Williams, the volunteer fire department in Williams Lake in the last couple of days is fighting a huge fire right on the edge of the community. So those initial calls, those initial decision-making processes, the activation of their local emergency plan, the escalation of that to include provincial and national resources is completely dependent. The success of that and the nature of what that broader response is going to look like is absolutely dependent. We really don't talk about that. The provincial, and my experience as a frontline guy, as a senior leader in provincial government, and as a fire chief, has been that nobody really realizes that the vast majority of the wildfire responses are started by are initiated by a volunteer fire department. Nobody seems to be talking about the fact that there's 30,000 less volunteer firefighters in Canada today than there was 5 years ago.
Yes, definitely. So I think that background to volunteer and just the amount of people we have that are coming into the domain, that is an issue we recognize. And I think as we look at the question later on of factors influencing the need for the CAF to come in, geographic scale, the national risk profile, that's definitely a big one, but also just the amount of people that are available to contribute to these emergencies. Pascal, your thoughts?
Absolutely. And it's interesting because we didn't rehearse this, the four of us didn't get together and decide what we were going to say at this. So it is interesting. Sometimes I think I'm the only one that sees the gremlin on the wing, right? So, but just to kind of, I think, touch on, and Michel started it off, and then Jeff with highlighting that, the size of our country and the risk profile that we have. But the thing that I feel that I would offer that is almost sometimes a barrier for us is two things. We are a large country with no population. We're strung across a little string along a border. We have pockets of population that are often very resilient on their own. Coming from Vancouver, where nothing bad happened while I was growing up, since I left, things kind of got worse. But if my latte was the wrong temperature, that was a bad day. I moved to the Maritimes. They have seasons for bad things, right? And I'm like, I never used to pay attention to weather. I pay attention to weather all the time now. And we see things coming for quite a while. But I find the resilience here, they're very hardy, and the communities themselves looked after themselves. But when we talk about whole of government, and I appreciate the whole of government, I agree with Jeff. So I'll start off with that piece, that I agree that we have a good governance level within the country. But what I feel is missing, and touching on what Michel said and Ernie said about that local impact, we know that responses are bottom up, and they have to be they are set up like that, is we don't have a whole of community approach. And I think that's, for me, that's a gap. We push things like 72-hour kits, which is fantastic. 72 hours is made for Florida, where they get support in a short period of time. We have communities in this country that when they lose power, lose it for weeks, and the 72 hours isn't enough. We have populations in this country that can't afford their bills, let alone stockpiling stuff to last them for 72 hours. We have people living in residences, apartments that are so small, they can't store days and days of equipment or supplies. So, but by having a whole community approach, really that bottom up piece, I feel is something that we really need to be emphasizing and pushing, and that needs to be top down supported and then broaden it out. And if we start to make, everybody on my street has training and education, and Michel pointed it out about people self-rescuing or rescuing neighbors after earthquakes, or we've seen it in some of the floods and the different things that impact us. If we train them, give them a little bit of training, follow the CERT program that's in other countries, follow that basic first aid, stop the bleed, short how to do a big, little rescue, size up of damage. Well, if my street's self-sufficient, my street next to us are self-sufficient, and our neighborhood is self-sufficient, the blue lights are going to be delayed in getting to us, but we're able to do that, or they can reprioritize. And I don't see that really happening. And I know some communities do it better than others. And as soon as I say that, someone's going to say we do that. But I really feel that whole community, because whole community includes governments of all levels, but it includes all those other partners, as opposed to separating the two. And I feel that that's, to Michel's point, people will then hit the button and say, oh, we need the CAF, right? We need the CAF. But you don't. And what does the CAF really do? And I think a lot of our misconceptions in Canada, not just by our citizens, but by a lot of our decision makers and leaders, is the influence that the American TV has on us. They see a disaster happen down there. They see every governor has a private army in their state. We don't have that. The reservists are not private to that province. They're part of the military. We don't have that setup. We don't have the alphabet jackets that show up every time there's a major incident that happens, because we're not set up the way they are. And quite frankly, we don't have the fatalities and the injuries to support that. Nobody wants to talk about what may not happen, what doesn't hurt anybody, and what's going to cost money. It's the men in black piece, right? We don't want to know things come and go every day. So we don't want to spend money on it. We don't want to think about it, because when it happens, to Michel's point, we're going to hit 911. Responders are going to come and save my life. And if they need saving, they're going to call the military. But we know that doesn't work. And I think by in my opinion, that if we can support a whole of community approach, which we're starting to see, but almost by default, I don't even know if that's that organized, but we're starting to see that with some of our amazing communities. But to Ernie's point, we've only got so many volunteers. And in some of these communities, that volunteer is everything. They're the firefighter, the first aider, the auxiliary police officer, the Coast Guard search and rescue guy. Like, they are everything in that community because there's only so many people that will do it. So I'll stop there. And I didn't touch on your FEMA point. I'm happy to go down that whole route if you'd like to, but we'll probably touch on it.
Yeah, you did definitely mention the alphabet jackets, and I appreciate that. But I think you also do answer the question in the chat from Pamela, speaking to the impact on volunteer fire departments and just across the country. And I'm interested to see here that, the idea is the conflict, the dichotomy really of whole of community versus whole of government, because although they do correlate, like they are very similar, they're also, one's bottom up, the other one's top down in some respects. So it does segue into the next question, which actually pertains to the research we're looking at doing. When it comes to vulnerability and resilience, how can provinces and territories best prepare to avert the need for commitment from those federal assets? Like, what can they do to prepare specifically? And is it a regional question? Like, do they have to have different approaches regionally based on where they are, going back to that regionalization? Or is it more something we can look at instilling in terms of, standards and best practices within the communities? So with this one, I'll lead off with Michel, and then from there, go to Ernie, Jeff, and then Pascal.
I would suggest that the first thing we have to solve here, before the level of engagement or level of analysis, is the whole concept of a disaster. We are still to this day developing emergency response plan to respond to local emergency situations that are not disasters. So we're planning for things that are easy, and I'm referring here to the 7 sins of I'm forgetting his name, the former FEMA director. He wrote on the 7 sins of emergency management. And one of them is planning for what's easy. And that's what we're doing. So we're planning to evacuate a small number of people that will all nicely come into a shelter with no pets, with no disabilities, with no language, and they will all be then citizens of that community forever. Not addressing the homeless, not addressing the newcomers, not addressing the all variety of pets that people have in their households and that they don't want to leave home without. So I guess we have to start revisiting what is our conceptual definition of a disaster and make sure that we don't lose sight of that when we develop the plan. And only then will we have probably a more welcoming approach to mobilizing assets. Otherwise, it's easy to say it's going to be 911, local emergency services, if not DND. And guess what? That's a kind of replication of the FEMA model with the MERS units and everything else. But even if we're looking to south of our border for some examples or inspiration, I don't suggest. Actually, we could question ourselves: is their disaster response such better than ours? When we look at the Louisiana floods they had in '95, one would wonder. And it's a large state, it's a large city, and 5 years later, we were no near any kind of recovery for that community at all. So, and I did my PhD in the States, and I did, as part of my PhD, I did an internship with FEMA during the Oklahoma City bombing and the Louisiana floods of 1995 then, before Katrina. And it was amazing to see all this soup of alphabet and the emergency support functions. Everything was policy and planning driven, but on the road, the action was not there. It wasn't met. It wasn't connecting. It was not leveraging the assets of the community, even though the national response plans of the United States is boldly saying in capital letters and bold that they are supporting states that are, but the way to deploy is not actually leveraging those assets. So response is starting at the local level. And when we realize that the threshold of our daily routine emergencies is surpassed, we have to switch gear into a welcoming, encompassing model that does not turn down resources. Convergence has been seen by law enforcement as a problem for controlling perimeter. Converging is a social response, like a stress response at the society level, where people want to come in and help. So we're always looking at the bad side of things, such as tourism and price gouging and looting, which is probably more strongly related to mythology than the facts, but people are just helping. And we see that on every single disaster here and abroad. So let's not forget that we should build upon our global response to the natural spontaneous response of people, and standardization. And I know it's kind of the elephant in the room anytime we talk about disasters. Shouldn't we be standardizing a response system? Well, in the States, they say that they have done that by legislation at the federal and at the state level. But 70 years later, the model that has been effective for fire service has, let's raise the question, has the model that has been effective in the last 70 years for fire service and fire management been effective in responding to large-scale disasters, as our US friends are promoting? And that some in Canada are also promoting. The question, in my mind, deserves a better attention than just following the propaganda here.
Great. I think that's some important insight when it comes to speaking to standardization. It definitely is that elephant in the room. I'll open it up to comments there. Happy to start with Ernie and then from Jeff in terms of that from the law enforcement perspective, but also at large in terms of applying those systems, at the smaller level to like the large scale disasters.
Yeah, thanks, Alex. So I think there's a couple of things that we need to keep in mind. You asked earlier about what it was like back in the good old days when I started in the early '80s, when I started in the fire service. Other than Mississauga, I don't remember an emergency event in Canada that required the entire evacuation of a community. Last year, we had multiple communities in BC and Alberta that were, and including mine. I was actually, for the very first time in my life, was an evacuee and got punted out for the McDougall Creek fire. So our response system isn't set up for that. Our planning structures aren't set up for that. And our planning structures don't recognize the fact that most of the senior municipal officials in many of these smaller communities where this is happening will have never dealt with this type of an event in their community before. Sadly, Ashcroft and some of these others are getting very familiar with it, but most communities will never have faced this type of an incident, and we're expecting them to somehow use these highly complex plans and legislation and whatnot. And our experience is that they don't understand the application of the authority. The plans don't fit the community. The organizational structures that we're promoting. We were in a community just here recently. The entire staff, including a volunteer fire chief for the community, was 4. Well, an ICS model, they don't have enough people to fill the top boxes on an ICS model, and who's doing the doing. But our assumption at the higher levels is they're somehow going to make this thing work, and that's the gap, in my opinion.
Okay, great. So that gap definitely exists, and I'm glad that we're highlighting it there. Jeff, any comments on that?
Well, exactly. Just to kind of amplify what Ernie says, I mean, it's a research question. When you conduct research, finding brilliant answers to the wrong question is often what happens, right? Mm-hmm. So I think first we need to understand and ask the question, what is the shortfall sought by the provinces and territories when they reach out for defining the scopes of their needs assessment within the provincial and territorial before solutions are remotely possible, before we start imposing a solution on the need for, something to be done in the provinces to ameliorate the need for the CAF. We need to first identify what is that shortfall. I mean, is this a call for a surge capacity in labor and equipment? Is that surge capacity defined in a specific area? Is it wildland firefighting? Is it helicopters? Is it off-road machinery? Once you define that shortfall, then it is logical and moral, I'm going to argue, for the provinces and territories to look inward to see what assets lie within their scope. how they might be accessed during a crisis, and how to build the cooperation and coordination to mobilize that. But, you know, for the CAF, the costs related to deploying the CAF are not recovered from the provinces and territories, whether that be direct, indirect, or the opportunity costs. I mean, as such, there's little incentive for the provinces and territories to create an alternate capability when there's a simple, deployable, self-contained, and absolutely free response force. It transfers the leadership burden from the premiers over to the federal government to come up with something, and places the responsibility on the CAF to deploy the IRU, which I'm happy to talk at length, dislodges the unit's entire training program and training plan towards what they actually exist to do. You know, if we talk about it being a robust strategy for employing local resources first from across the spheres of society, then the CAF remains what we call the force of last resort, right? So when a province has employed every adult human that's available, every piece of equipment that's available, and have brought every piece of society, all the NGOs, the entire corporate Canada, and everything's brought to bear, and there remains a shortfall, then you get all the Canadian Armed Forces and the federal government to fill that hole. Now, I'll end with, there are exceptions to that, right? Certain things, technical skills and capabilities like direct action counterterrorism, tactical airlift, right? We don't expect the provinces to create their own air force to evacuate a couple of First Nations every year. That would be illogical to do so. Intelligence fusion, offshore power. There are some finite skills that do belong and remain in the RCMP or in CSIS or in the Canadian Armed Forces that don't make any sense to replicate at the provincial level. But I really think, to circle back to my initial point, that we really got to get back to defining what is the shortfall the government of Alberta faces on a recurring basis that they need to be filled by something. Define that. That's the province's role to define, and then to figure out a strategy to fill it. And right now we offer them no incentive to do it because they get a free, cool force and they get to take some great photographs and mic moments next to some uniform folks, look cool, look like they're doing wonderful things, when in fact I'm going to argue, and it may be provocative for some, but I'm going to argue they're walking away from their leadership responsibilities by pressing that easy button. So I'll leave it at that.
I'm really glad you mentioned that, and I have to agree in some regards from a personal basis, having deployed on Operation Lentis before. I would argue that there has been improvement since we've seen the earlier version of Op Lentis in terms of having collaboration and not just having the Army show up and everyone kind of let go and let the Army take over. I would be curious what your opinion is, and the opinion at large of the panel on different methods that we can employ at the tactical level, such as having liaison officers that are actually working within the EMOs, identifying those early, having assistance in terms of drafting the request for assistance templates. And those are things that we're going to look at for future webinars because they form the basis for some of the questions that D&D has actually asked us as part of the Minds program. But Jeff, you really do hit the crux of the issue for sure there when it comes to discussing the IRU, because it is true when the CAF is called to come and respond to emergencies, they're not working on what the CAF is actually supposed to be doing, which is training to go overseas and be with NATO, or provide protection or sovereignty protection to Canada at large. And that is part of the issue we've seen with the defense policies and whatnot, which likely in the cyclical basis forms the framework for why Minds is having us do such a program with the Canadian Journal of Emergency Management. Pascal, interested to hear your comments and thoughts about this, and definitely answer some of Jeff's provocative comments there on his own.
Hey, 100%. And that kind of goes back to what I was saying earlier. I think a lot of that, it falls to Jeff's easy button for decision makers and politicians, really, that it's easy to do that. We've all seen that firsthand. But again, it goes back to, we don't have that economy of scale, and we don't have communities. I don't know of any community, I'm sure there is one somewhere in Canada, that has a rescue helicopter. People have these misconceptions of what's available because of TV, because of movies. The Canadian Coast Guard does not do rescue with their helicopters. That's a CAF ability. It is an Air Force helicopter that comes and pulls you out of the water, pulls you off of a boat. In the States, it's the Coast Guard. It's a totally different approach, and they've got tenfold of what we have for equipment and resources. But we're right. There's so much of what we can do at that level, and Michel talked, sort of touched on it with that capacity piece. I'm hearing a lot, and we fall into this, and I love the title of this, the lights and sirens to resiliency. There's always the focus on the blue lights, how we're going to respond to that incident. But response is such a small part of emergency management. A lot of people get confused that emergency management is not emergency response. As emergency managers, it's our duty to prepare the community to provide that counsel to legislative bodies to make them understand beforehand what this is about. We will see the odd exercise, and it's always a big sexy exercise. We want to make it look, bring out all the toys, bring out everything. But when was the last time communities had a conversation with their provincial and federal partners to say, if this happens here, what should I expect? We have emergency managers by title in a lot of communities. They're doing it on an 8-sided desk with no education or little education, unless they can afford to go take a degree in this country, because emergency management in this country is an academic moneymaker. And that's no disrespect to our panelists that are faculty at different schools, but there's no provision for that. We don't have our college anymore that was a great resource for organizations and built interoperability before we were preaching interoperability. And when we look in our communities, we're really good at our high risk, high probability issues. The bad things that hit us all the time, our responders are top notch on. What we don't tend to do well is those high risk, low probability, and that's where emergency management should be pushing that. And that's where Gordon Graham, I'm sure everybody's seen some of his amazing productions and stuff on that. High risk, high probability, and practicing the high risk, low probability. We're really good at that. But a lot of what happens, and again, a lot of what happens in our country, short of the earthquake that's unpredicted. As I say, it's a turtle with rabies. We know for days and weeks that bad things are coming, but we wait till the clouds get dark to go buy our propane. And where are we with that as at all levels of government, local government, provincial government, territorial governments, working to make those plans and to have those very resources we're talking about. And to Jeff's point, do we need the cap here because we need extrication off of roofs? Well, don't we have other ways of doing that? Don't we have other resources? And we probably don't, but how do we build to that capacity? And what we do see as a positive in other jurisdictions, in other countries, is that private response. We're getting better, I think, and I'm starting to see it in the Maritimes where if a hurricane's coming again, we know for weeks it's coming. It's not a surprise. We see the damage it's causing. Blizzards are the same way, that we're starting to get our neighbors, our power companies are starting to come. Instead of being reactive, they're starting to stage, which we're starting to see slowly. But when we look at the preparation phase of a hurricane in the States, you have Walmart that has, long lines of trucks ready to go to deliver supplies to people. And I don't know if I've ever seen, maybe in some jurisdictions that's happening, maybe in the prairies or Ontario, but where are we working with our private partners, with our suppliers to give those, that's what people need. They need some supplies in that first little bit, and there's some great private companies that provide that. I'm not trying to pitch Walmart, but that's the one that you see a lot of in the States. They have a very robust response phase, and we see that with a lot of our faith-based groups. We see that with a lot of our NGOs. But I really think we do a lot of focus on the blue light response to phase. That's such a small phase of emergency management, and we spend no time in the recovery and looking at lessons learned because we just get back into our regular day. But if we were to focus on those other phases, maybe that response phase will go a little bit smoother. To Michel's point, that we think it's gonna, because we have all these plans, but most of those plans, if you put $10 in them and put them on the shelf, go back a year later, it's probably $10 is still sitting in that plan, right? When was the last time it was pulled out? So I'll pause there.
Definitely lots of great points. And I'm glad you mentioned Walmart, because we're going to segue into some discussion about private businesses in a second here. But I also like that you did speak to the point that Michel had been brought up about disasters being actually framed, right? Because not everything's going to be about emergency response, but about emergency management as it is. So I do want to actually bring that question in, when we talk about emergency response, emergency management, and business continuity specifically. What are best practices we can look at when it comes to aligning public and private organizations? Like you mentioned Walmart and whatnot, to the benefit of these municipalities. Does the private sector have a piece to play in this? We definitely saw from CrowdStrike IT outages earlier this week that the private sector can, affect things like, public transport and whatnot, be it flights, be it in the medical and healthcare sector. So what stake do they have to play, and how do we have them onboarded early as part of the preparedness and not just the response? And I'll open that up to Michel first.
Well, I would say that the NGOs are part of the private world as well, and the private organizations. We're just not for profit, but we are private organizations. So my word here would apply to both the commercial private and the non-for-profit or non-governmental organizations. These organizations play a significant role in everyone's livelihood on a daily basis. And unfortunately, as Pascal mentioned just minutes ago, these contributions are overlooked during disasters. It's a nonsense. We just don't put aside what we do every day to start something from scratch, or try to manage people coming to donate individual bottles of water that we have problem packaging and reshipping, when we can have pallets ready to redistribute from corporate partners. Even the corporate world is blending with the NGOs right now, because a lot of NGOs are developing partnership and MOUs with large corporations to either have access to support and even staff. So this is something that seems to be like very siloed, the corporate world and NGOs, and I would suggest that it is very different. But before we look at the specific operations, I believe we have to take stock of the capabilities that resides within this private world. So we talked about logistical chains, staffing, knowledge, some buildings. So there's a significant footprint of the private world out there, private organizations. A lot of those capabilities are unknown. So I guess we have to start listening and looking and share information about what are the capabilities. And I would say that we're not that far, and especially I'll take as an example CAF. People say, well, the Canadian Armed Forces are deployed self-sustained and all that. Are they that self-sustained? Not at all. They are relying on just-in-time distribution and logistical chains with the private commercial organizations. What is less known is that the CAF is also dependent upon NGOs for its primary operations. We talked about search and rescue, but are we aware that there's only 3 Air Force bases that are providing search and rescue capabilities across this large country? How could we save a lot of lives from those marine and air emergencies? It's because they rely on volunteers. They rely on hundreds of CASARA teams across the country that are well-trained, certified, and everything. So it's not because someone is volunteering that they are amateurs. And that's something that is also often perceived as the common thread. Like, if you get volunteers, you get amateurs. Well, you get high-skilled professionals. A volunteer physician, a volunteer nurse, a volunteer paramedic, a volunteer first responder from St. John is not an amateur, is a professional and healthcare professional that is devoting some of its spare time, of his or her spare time, volunteering in an organization that is committed to the well-being of their community. So the same holds true for the search and rescue. Law enforcement across Canada is dependent upon volunteer ground SAR teams for their major operation. And these ground SAR teams have more hours of training than most law enforcement officers or Canadian Armed Forces personnel in search and rescue. It is their dedicated task, and they are trained for that. They are training and retraining for that. So I guess we have to take stock of what the private world, for-profit or non-for-profit, can bring to the table And then we can have an open dialogue on how we can implement that. And this would be a significant relief to communities, but also to all of government approach, understanding that even governments is relying upon this private world to support them.
Well, I firmly agree, and I'm very appreciative of the comment regarding just in time. I can speak from experience responding to floods in the capital region in 2019, just as one of the company second in commands going to Canadian Tire and just buying all of their hip gaiters to be able to go through the water. So it's a good example. And you speak to the volunteers, and it's definitely true. Buses of OC Transpo would be showing up to the disaster areas with just full of volunteers that wanted to assist. So I think questions now become in terms of that. Is there a need for a volunteer registry, like a national volunteer registry? Is that something we should be looking at? How do we take people's skills and register those appropriately? And then how do we take those skills and funnel them to the right spots so we don't have people, like as part of the reception, staging, and onward movement process, something that CAF has worked on and developed as part of its standard operating procedures. So happy to open that up more, Jeff. I'm sure you have some comments in that regard and continuing to speak about, the private sector and incorporating volunteers, be it from communities or from businesses at large.
Yeah, absolutely. And so if we're going to jump 2 feet into what, whole of community actually means and what we're talking about, we have to remember that in general construct, there's 4 spheres to society. You have the civil society, the population, the public sector, the private sector, and the not-for-profit world. Each one of these spheres conducts a response operation to an event. Right? So every time we have a disaster in Canada in a location, there are 4 distinct and separate response operations undergoing. One thing we have to remember is that the public sector response is a response. It is not the response for which others need to fall under. The incident commander on the ground commands public sector resources only. They're not responsible for private sector or not-for-profit resources. This isn't a command and control. I'm the guy from the government and therefore I control everything that's going on. That's not how the model works. So understanding that, what we do here at my company, we've kind of pirated a military ideology and we've created something called intelligence preparation of the disaster space. So basically, this is a process that the military undergoes every time that they want to conduct a military operation in a specific geographical location. They go through a series of studies, a very deliberate process where they identify all the aspects. For example, for a specific, we're talking emergency management, does the emergency manager know the full scope and depth of commercial operations within their area of responsibility? I don't mean the threats. I don't mean the ones that can go boom and the trains that can derail, but every single capability and capacity that exists within their AR. Do they know the people, what they employ, their special equipment, the status of that equipment, and have they created positive relationships, not Rolodexes? I could care less if you have a contact list. It's useless. I mean, actual positive personal relationship with members of corporate society, not-for-profit society within the civilization. And it's the same for the not-for-profit sector. Who is there? What are they doing for whom? And how can they scale and sustain? And the activation context requires these relationships to exist prior to. Just because you're in crisis as a public sector emergency manager, that doesn't mean everybody else in society is. So when you open up your Rolodex and call somebody, say, I need you right away, your emergency doesn't constitute an emergency on their part. That's why we build relationships. And I'll give you a prime example. And for if you've deployed to the floods in Ottawa, Alexander, you'll understand this one, right? I live in Canada, the western end suburb of Ottawa, right? There's about 1 million people in all of Ottawa. Canada has more deployable tradespeople, structured labored organizations on long-term construction sites, and more heavy equipment just in this end of the city than the entire IRU at CFB Petawawa, which is currently based in the 1st Battalion, the Royal Canadian Regiment. So if you were to call on the construction industry in Western Ottawa, you would get greater numbers of people, greater levels of equipment, and you would get them in a time frame that the CAF could never match. And you would never need to call the CAF. So I would argue with a country like Canada, where 80% is urban and it's growing greater than that, we do have surge labor and surge equipment capability in all of our communities that is currently summarily being largely ignored by the emergency management organizations, because let's be honest, the default is I want volunteers because volunteers show up. I don't have to pay them. I just throw a little bit of cine buns at them and everybody's happy. But when it comes to volunteer organizations, the DRC talks about emerging and extending organizations that'll show up during a disaster response. Again, it's back to who are they? What do you need them to do? And it scopes back to an earlier point I made about truly understanding the gaps that exist in your AOR as an emergency manager. I will have a shortfall of this. I will have a shortfall of this piece of equipment, this type of equipment, this group of people, this specific capability. I can identify that shortfall in advance. I can find that shortfall within my community. And if I can't, then I start a strategy of engaging external, shouldering municipalities, higher levels of government, etc. But what the private sector asks for, and there's three things and three things only, and I've had many conversations with members of them. One is indemnification. The second is access to training funds, similar to that, what you see Public Safety Canada offers for the emerging humanitarian workforce to do training. And just like every other NGO, they're simply looking for cost recovery. There's no profit motive in their desire to participate. And we have to remember that companies are residents of our communities. The people that work at companies, they're our neighbors. They want to jump in with 2 feet and be 100% participatory in emergency management. We just actually have to open the door and let them in. So my argument is if you're looking for surge labor and that kind of capacity, you have that existing already within communities across Canada. Now, again, I acknowledge that 20% of rural Canada has 3 people in their private fire department, and they won't be able to do this. I completely understand that. But for the 80% solution in our cities, we have what the CAF delivers already existing across the spheres. We just need to use a real whole of government and not just a monkier title.
Well, firmly agreed. I think the discussion there about really all those the people in Canada is a good example. Really, I think part of the discussion is how do we codify that, right? How do we put them in? And it goes beyond the contact lists like you're mentioning. The Rolodex is not enough. Ernie, happy to hear your piece on that, because obviously you've transitioned from the public sector to the private sector with Firewest Consulting, and I'm sure you've got some comments on that.
Yeah, a couple. First off, I listen with fascination. I absolutely agree that relationships need to be struck, but who's going to do it? Everybody. I'm just going to speak from my own personal. City of Regina, I had one person in an emergency management role and couldn't get council or the city manager to consider adding additional resources. City of Lloydminster, 32,000 people. I was the full-time, and that was what I focused on. So I had all sorts of time to build those types of relationships. City of Leduc, with all sorts of community risk, I had 0.1 person in the emergency management role, and I wore the title. So I mean, these are not the little tiny prairie communities. These are significant industrial commercial centers that are just not investing in the emergency management program, and then you're shocked that things don't happen the way they should happen at the end of the day. I mean, it to me it seems a bit of a no-brainer. So I think the lack of investment in the provincial governments have been really good about creating amazing frameworks, and I don't want to not recognize the fact that amazing work has gone into building these great programs, but there's been no work in forcing municipalities to make, and First Nations and whoever else, to make the investments necessary in their programs to be able to actually tailor that to the community and then identify those relationships around them. It's that lack of relationship. We might want to look at like a NATO thing where if you're a municipality, you're required to spend 1% of your annual operating budgets on emergency preparedness and management. Maybe it's 2%, 1 to operations and 1 to prevention and awareness programs. Don't know, but I think that lack of investment is probably the biggest impediment to building those relationships, because you got a whole bunch of people that are going flat out just trying to get their day-to-day done.
Ernie, you bring up a really good point with the 2% there, and just specifically because we are in the CAF context in the Mines program, I did some research very earlier on in my career, speaking to other nations that are looking at that in terms of including in the budget. So, for example, the Spanish military has emergency management battalions that are incorporated within their structure, and I'd be curious if that calculation was done, how much closer Canada would get to 2%. Definitely not over the mark, but it's an interesting incorporation, and it's one of those rabbit holes we can go down, just like I know Pascal's previously gone down the FEMA one that I keep mentioning here. So, Pascal, over to you for some comments on that, and I'm happy to hear about what your opinion on this in terms of the private-public sector debate is, keeping in mind the various different disasters we've had as of late.
Man, you keep wanting to get me on that pedestal. But I'm not gonna right now. I want to focus on, I mean, I think there were some key points that were brought up, and I can't, I mean, I touched on it earlier, and Ernie, sort of hit it home again. A lot of what we've talked about today, and a lot of what people like to talk about, is the response. Your blue light agencies and your CAF. And, we touch a little bit on volunteers, but a lot of communities are leery, and for whatever reason, right? We go down to our pillars of excellence. Nobody wants to break the silos. And, I've been trying to preach interoperability for at least 20 years of my life. Interoperability is not radios. Interoperability is not technology. Interoperability is the people. When interoperability works, it works well. When it fails, it's because somebody chooses to not use it. And to Jeff's point, we have more capabilities in private sector, and Michel, I'm going to say private, but like the volunteer groups, everything, clumping it all together, than we do in our, there are very few police, fire, or paramedic services in this country that can handle a major disaster on their own. I would offer none can. A major disaster. They can do great local emergencies, but even then, a lot of them are limited to an emergency. Even some of our bigger cities, they don't have some of those capabilities. And I think it was Michel that touched on it, so I got to give the shout out when I said that people can't do like helo rescues other than the CAF. North Shore search and rescue. Volunteers that have been doing decades. I don't know how long they've been around, but as long as I've been around, they've got an amazing helicopter rescue with a private helicopter and volunteers, and they do long lining, and they do that. So we have those capabilities. When was the last time we brought our the labor industry, the associations or the unions or the organizations into our emergency management meetings? When was the last time we brought them to an exercise? We struggle to bring some of our volunteer organizations together with our quote career full-time organizations. So until we break down some of those pillars of excellence, we're going to continue to see that. And I agree, it's not about a Rolodex. I always say it's too late to have your Rolodex when there's an emergency. It's too late to hope you have a relationship. By the time something, when the balloon's gone up, now is not the time to hope, I'll find out what Jeff can give me. And I like what you hit on, that it's not necessarily your emergency either. Or you may be dealing with your own because you can't support me. But if I don't know what resources you have or don't have, and that goes back to the expectations, if we don't exercise, and we don't have a national exercise program, let's face it, everybody just kind of does what they want to do. But if we don't have a proper dialogue, exercising, relationship building beforehand, I'm going to assume that Ernie's going to bring this with his department. And when I call Ernie, he's going to go, we don't have that capability. And that's on me to have not known that beforehand. So I think when we really start to look at this, and I want to touch, because we've sort of touched on it, and this is a DRI event. So we don't have, as much as we don't have emergency management controlled in this country, we don't have continuity either. And in the States, when you look at their federal offices and government offices, they have to have continuity of operations personnel. They have to have continuity plans. We don't have that in Canada. Nobody has to have anything, right? So how do we maintain our services? How do those businesses stay open to support others? How do they have the resources, healthcare, government offices, everything else? What plans do they have in place to keep their lights on when these have happened? And again, we leave it as they'll have it. Some organizations do it very well. Some organizations have very robust, business continuity plans. But we don't have that with government. We don't have the mandate that they do in other countries where there's a mandate to have that. And we go back to Ernie's point about the capacity at the local level. Even in some of the bigger cities, we don't have emergency management on an equal footing as all the other levels because we don't want to think about it. I've had mayors tell me in other provinces that they don't put as much emphasis on emergency management because they know the fire department will just do it all. And that's their answer. There was when I was doing some research with one community and they shared services with another community for the most part. They literally said, we don't share the zealousness of the other community when it comes to emergency management because our fire department, police department will take care of things. That was their answer. And that's unfortunate. That's duplicated at a lot of different levels of our organization or of communities. So until we kind of are able to get people to understand that there's more than just the response piece, when we realize that there's that keeping those relationships ahead of time, who's going to do it, Ernie? You're right. Who's going to do it? The firefighter, hazmat training and emergency manager, right? That his priority is to do all these other things. Oh, we got to fit in emergency management. We got to get it in the calendar, do an exercise. Like that, those are until we give that recognition to do that work before, during, and after. I think we're going to continue to have these same conversations. I don't think we're going to, like interoperability, great catchphrases. We're going to talk about it, but are we really doing it? And I would offer we're not doing it.
Great. No, and it's a good point. I see Michel had his hand up, and it's good because I was segueing to him because I know in terms of continuity, it's a big piece right now, especially as we saw the National Emergency Coordination Center get stood up for the Labrador fires. I believe it was one of the first times that St. John Ambulance actually got to activate that as part of the HWP. So curious, Michel, on your thoughts, please.
The recovery, it's funny, we're putting label emergency management, emergency response, recovery, but we're all looking from a different perspective at the same risk cycle. So it's just funny we're looking at it and from different angles. But when we take a step back and we look at what are the incentives, and this is something we've touched on through the comments earlier. What is the incentive for a community to improve its prevention mitigation? What's the incentive to build up their preparedness? What's their incentive to have a robust response and recovery model when they know that they will have financial assistance from the province, and the provinces will be reimbursed by the federal under the FAA? And what's the difference? What type of difference there is between a community that invests some of its own budget in emergency management and those who don't invest nothing and rely on everybody else to come at the end? There's no difference. So maybe the FAA was initially set up for supporting the unexpected cost, but to a certain degree become a disincentive for setting up mitigation and preparedness. I would offer that resilience recovery has a whole lot to do with resiliency. And to create recovery, it's not after the fact, it's what you invest before the fact that will have an impact on recovery. So let's not forget what we can do on resiliency, what we can do before and after a disaster. And this is where connecting the dots, building relationships, taking stock of capabilities. And I would even suggest that we revisit the ways we look at what other brings to everyday society as a lever to resiliency. And there's a lot of parallel with sustainable development. When you look at the 17 objectives of sustainable development, you suddenly realize that a lot of things there could be relabeled under the umbrella of disaster resilience. And it includes health, it includes education, it includes resilient communities and infrastructures and jobs and everything else. So maybe we could look at what our education system in each of our communities bring and can contribute to the resiliency of the youth and the household. We can look at what public education is and how they can contribute to that. And I'm coming back to what I've said earlier. First aid, would it be from St. John or other national organizations that share the same CSA standard on first aid training? Any first aid training is a good tool to sensitize people on how they can make a difference when some emergencies happen. And remember, a large disaster is different. Like the low probability, high consequences event are different. But at the individual level, one person bleeding, the difference between a one person bleeding in a single emergency and a large scale disaster is during a large scale disaster, that single individual will be waiting, expecting assistance from immediate vicinity because external help will not come early enough. But that's part of education. That's part of sensitivity, reality check. And to a certain degree, we have to adjust the public dialogue to show the vulnerability. We have to celebrate resiliency and promote it, but we can only get there if we create that discomfort. If people realize they're at risk, then they will behave in such a way that they will protect better themselves and contribute to the overall community safety. So if we really want to focus on, if we really want to get to a broader disaster recovery, we have to invest early and in a broader sense into risk management and public education.
Well, I'm glad you mentioned education there, Michel, at your end there, because I think it's a big piece. And I know there's people obviously within the panel here specifically, well, I mean, everyone, Pascal, Jeff, and Ernie, that have similar thoughts on education, because I know we've talked about that in previous webinars and events. Jeff, I'd love to hear your thoughts on that first, in terms of where education comes into play and how do we insert emergency management, preparedness, and resilience, not just from a response perspective, but really from a, cradle to grave approach when it comes to putting that into the education process.
Yeah, absolutely. And I use, in a lot of my writings online in different places, I use the phrase that preparedness is where the response fight is won. And I firmly believe that if you invest in preparedness, you're investing in response capability. The education piece, though, I think has to be designed around what we determined what does a resilient individual look like? What does a resilient community look like? What is it capable of doing? We have to have, it's reverse engineering the question. What is our desired outcome? Before we talk about what education pieces need to be deployed into what situations and at what levels, we have to first design what is our outcome. What are we trying to achieve? What does a resilient, and I use this with my students in the graduate program for emergency management. I said, if we stand a prepared individual at the front of the room, can you describe to me what they are? What are they capable of doing? What skill sets do they have? Now, transpose that exercise onto a community. What does a resilient, prepared community look like, right? Because we don't know. Once we determine what a resilient community looks like, then we can measure the state of our current community against that standard, right? And each community across Canada is going to have a different result of that assessment, right? There'll be what we refer to at my company as the preparedness gap. What is the gap in my community between the current state of affairs and what we've defined as a resilient community? I know that. I conduct a study as an emergency manager. I see the gap. Now I'm in a well-informed position to create an education program that's designed for the very need-specific shortfalls that exist in my community to the community that I'm aware of. This is a huge problem we have in preparedness education now. We have broad stroke generalistic education that is largely garbage, and I'm happy to debate anybody on that, because it's a swath singular preparedness message in education for a country of 41 million people, the second largest in Canada, is ridiculous, right? That's not possible. So what we need to do is understand where that individual gaps in the city of Toronto and the city of Peterborough, in Kamloops and Inuvik and Whitehorse and wherever you may be, what's the standard we want our community to be at, measure the current standard of our population, and then design an education. Now the education can be rolled out in the school system. The school system is probably one of the greatest targets to roll it out in, to roll out things in places such as that. In different avenues, but simply rolling out a preparedness education plan today to a general population is largely a wasted effort. We see it in Preparedness Week every week. every year. Rinse and repeat, same message. It's summarily ignored by the entire population, but we get that cool 3-phrase thing that everybody's supposed to do that's useless, but that's what our preparedness message is. We need to design an education that meets a gap we identify, but we can't identify the gap until we know the standard to which we want our population to reach. Then we're going to be in a position to design an education program. And I know it sounds like I'm repeating this over, but I'm trying to hammer the point. We see this in research all the time where we have a great answers to the wrong bloody question. And we have very finite, and I'll touch on this and then I'll stop. We have very finite resources in emergency management. And at the cabinet table, emergency management will lose every day against education, childcare, healthcare, the military, social care. Right? So there's no more money coming. Love to see investments, but it's not going to happen. So the community of practice has to understand that the allocation that's coming, other than some surge money after an event that may show up, these are the set of resources you have. So how can I best leverage that? And this is where the point I was making before about regionalization. You know, those 4 rural communities don't have the money to do it on their own, but maybe if they pool, they have the money to do a limited education practice campaign targeted at their population. So I think we need to get back to basics and let's actually figure out what the problem is first before we try to solve it. And I'll end there.
I'm glad you mentioned that, Jeff, in terms of the lack of money that's going to be coming in and the order of priority. I know in many of the fire halls, the one I volunteered with in Armagh, we had a big sign up that said specifically the quote, "No one else is coming, it's up to us." So in that regard, if we can operate in that siege mentality, not getting too far into the radicalization there, but that idea that we have to make the solution with what we have, play the poker hand you're dealt. I think we move forward better than that, as opposed to always asking for more and seeing, how we can continue planning and offering frameworks when the need is for action, right? And to actually do things. And this is part of the reason we have the basis for this event today. Now, pivoting a little bit, I know that we could spend days, and we're going to do that at the SEPSA conference and various events coming up, talking about EM. But as we hit 12:30 here, we're going to extend just to another 10 minutes. What I'm going to do is just read back a couple definitions and items we spoke about in terms of key takeaways, because my pet peeve is when we have events like this and we discuss things and it's always the same stuff and we don't talk about what we actually brought in terms of value. And then following that, I'd like to offer each of the panelists one more kind of turn of the table to provide any insight, speak about the organization, or just, closing remarks before we wrap up. So just going through today, obviously we discussed a lot about intersections of resilience. We talked about the whole of government approach and really community resilience and what it means for our organizations and us just as experienced practitioners and academics. I like that Michel mentioned we need to have a defined concept for disaster framework and specifically look at what a disaster is and how we apply to that. In terms of that standardization, which is always the elephant in the room, we talked about what the actual trigger for the CAF needs to be and if standardization actually even works. And looking at things in terms of improving, anticipating the needs for disaster management and bringing in federal government assistance, we looked at things like geographic scale, the national risk profile, and it was highlighted that we have 30,000 less volunteer firefighters coming in. So definitely having enough volunteers is an issue. And the influence that Pascal mentioned of the U.S. image of the National Guard and FEMA, this does influence our perception here in Canada of what EM looks like on a grander and national scale. So for the CAF, really, I think there's a need to identify specifically what the need is from the CAF and government when we come in. Is it specific resources, or rather is it just a surge capability? Do we need wildland firefighters or helicopters? And as having that as part of the RFAs, as opposed to just bringing the units in to take over and assume the leadership, I think we better service, the municipal and provincial levels overall. So that's another key takeaway we'll pull from that. It was mentioned as well, speaking about incentives, and I think Michel underlined this, what's the incentive to have communities or businesses build this up? Does it need to become part of audits? Are we looking to have funding or grants available? Like, what is the purpose and goal when we know the money's just sitting there for the response afterwards? So I think it's a mindset we need to shift a little bit and look at that. We had the quote again from Jeff, preparedness is where the response fight is won. I think that's the quote we had. So that'll form a basis of one of our reporting key takeaways. And really the need to incorporate this as part of education programs. So that starts as part of, the elementary school civics programs, or even having resiliency classes, or just understanding that. And I think the final point I really want to mention, and this is one we're going to hammer home as part of our report, is needing to define what a resilient individual looks like, and from there, what a resilient community looks like. If we can't actually define and set a standard, or at least an idea or a framework of what that should be, we're really just working towards a goal that continues to morph and change later on based on the process as we plan for this. Again, so these are the key takeaways, I think, just from my notes as I've been scurrying away and reading the chat that we're going to put into our reporting analysis following the event, at least from the first panel. And now I'm going to open it up to just closing remarks and final comments, specifically on those takeaways, should you have any. I'm happy to start with Michel. Any closing remarks or big comments? Thanks for being here today, of course.
Two things. The first thing is maybe we should look at the volunteer organization as a way to understand how we can translate passion, commitment, and professionalism into a task where the money is not the incentive. So maybe it's a way. It's another contribution that the NGOs could bring to the overall OVM. My second message would be: alone we go faster, but together we go further. And that is my hope for us as a society to develop resiliency.
Thank you, Michel. Pascal, over to you.
Thanks. No, great. And I mean, I've taken a lot of notes and learned a lot from my co-panelists, so I appreciate that. I think really for me, a summary and how do we build that culture of preparedness? How do we build that? All of the points that were said here, from identifying to what this is, to how we, all of the identification pieces, all of the problem solving pieces, all of the education pieces, is how do we truly build that culture of preparedness? And if we're, to Jeff's point about if we have that strong, preparedness phase, then we're winning at everything else. But we don't have that culture. And whether it's, as a whole, we have a lot of champions for the culture, but getting people to understand what that culture really looks like. We've said it here, the money's not there, the resources aren't there, and a lot of the times. And when we talk about neighboring communities and mutual aid agreements, those aren't always there because they're impacted as well. They've got a low support capability. When we look at the way SIFC is designed, both nationally and internationally, how they can deploy wildland firefighters across the country and internationally with international partners and bring them in to support them. Why are we not doing that better? Why are we not moving? We're seeing that with some of our volunteer organizations. They have that capability. As I said, it started off, and to me, volunteers are twice the citizens, right? They, stealing from Winston Churchill a bit there, but they are, we see this right now. St. John Ambulance, Red Cross, and other groups, I don't know who else is there, have gone from other provinces to support Newfoundland. Why are we not seeing that more often? Why, if a region is not impacted, are they not putting, whether it be heavy equipment and workers, if they're, again, if we need the CAF here to do it, we probably have those resources someplace else. And can we get them from a community? Can we start to build that into some of those expectations and those plans? But if that isn't worked out ahead of time, it's not going to happen. And I really think that culture of preparedness is what we need to be focusing on with all of these pieces. And I'll stop there. Thank you, gentlemen, for a great sharing and learning opportunities.
Thank you, Pascal. Ernie, over to you for your comments.
Sure, thanks. I'll keep it short. I'm just looking at our wildfire map for BC. We've got 454 active wildfires as we speak right now, and 44 communities have got either evacuation orders or alerts. The reality is that for most of these organizations, they will activate their plan probably for the first time in years. We don't use our emergency. We've created an emergency management program that we only use when it's a catastrophe, and we're surprised that our participants in our community don't understand their roles and functions within it. Why aren't we using it when we've got to shut down a block of road or shut a major roadway down, or we have a fair or a fireworks event or whatever else? Why aren't we being honest with our residents about what their expectations, what their community, what their program can deliver? And I hearken to a governor in either South Carolina or Florida that stood up on the TV and said, you need to understand this. There's a hurricane coming. It's dangerous. When the wind hits 40 miles an hour, we're pulling all of our resources into safe places. You're on your own if you choose not to leave, and it's quite likely you'll die. And I think that level of honesty is what's missing in our program. And then there's no accountability, but that's not necessarily the public's fault. I think that we can look at our own processes, our own approaches. So those are some of the areas that I think that we need to get our head around, is how do we increase that capability. Part of it will be demystifying the emergency management program and making it the horse we're riding all the time.
Thank you, Ernie. I appreciate those comments and the allusion to the importance there of understanding the dangers of disasters upon us and what the commitment looks like overall. Jeff, closing remarks from you before we wrap up.
Yeah, absolutely. It's a privilege to be here today. I'm going to close with one of the side joys that I have is I'm on the board of directors of the International Social Capital Association and the head of the Disaster Resilience Special Interest Group within that organization. And we're a collection and group of researchers, academics, practitioners, and experts from around the world that look at the value of human relationships in all different spheres of human activity and human lives. And I speak to the power of social capital as being the glue and the lubricant of society. It's what facilitates the flow of other capitals, human capital, financial capital, and physical resource capital flows along trusted relationships that are built between people. And when I speak before about the fact that all of these relationships need to be built by the emergency manager, yeah, absolutely they do. And they're going to be longitudinal. It's going to take them years to build that level of in-depth relationship across their community. It's not something that'll happen overnight, but it's something that builds. And one thing that we see often is that we see a falling trust in public institutions right now as a result of politics and a result of activities that were chosen within the pandemic. And so because of that, you're not trusted as an emergency manager simply because you hold a title and a position. I've done a decade of research on the acceptance and adoption of preparedness communication messaging, and people do not listen simply because of a position or title you have, or as I like to say, a cool crested polo shirt. None of that it matters to a small portion, but you matter because to the population you serve, because you've built a trusted relationship with them. And that takes time. You have to demonstrate value to the population and not come out of the woodwork when the world goes pear-shaped in front of a microphone and expect everybody to listen to you and to follow your instructions and do exactly what you want. So I really strongly believe that what we're doing here today is building social capital. What we're doing here today is building relationships across the spectrum. Invite people to join all of us on LinkedIn and every other platform that we're on to continue these type of discussions. That's where we'll be successful. The emergency manager in one city does not have the solutions, but that solution is in existence in somebody else's AOR. And by sharing and building these relationships, we will be far better as a community and a community of practice. So yeah, absolute privilege to be here today, to contribute to this mission, give a little back to the CAF after 28 years of serving with them. And it's an absolute privilege. Thanks again, Alexander.
No, thank you, Jeff. And I do appreciate you stealing my thunder a little bit with the social capital piece. It's a great comment and one that I tend to approach with and close because it's one of the big cross-functional needs, in terms of the volunteers, the private sector, the public sector. So I do appreciate it. So I'm not going to labor anybody else with closing remarks of my own because I think everyone has echoed them perfectly here as the experts that you all are on the panel. We really do appreciate you all being here to share your expertise, your insights, and your knowledge, and it's going to go a long way towards supporting the research being done, and that is provided directly to DND and Public Safety Canada, which in the long run I think will benefit the communities at large as part of the Minds project we're completing here. So thank you all for being here once again. Thank you to our participants, of course, for being patient as we were trying to get the technical issues resolved. You should see the recording posted in short order, and of course the reports should be published in the coming months following that. And also keep your eyes out for future events, of course, which will have some of the same panelists, some new ones, as we look to expand that social capital and that network. And I would actually invite everyone this afternoon to join us for the French panel, which will be our second panel, starting with opening remarks at 1 p.m., which you can see on the left side for the sessions list, and then at 1:15 for the actual panel itself. But we're going to look at specifically, the French side, a little bit of Quebec, but also pan-Canadian from a French perspective. So that should be a very interesting one as well, especially for those that are going to listen to me speak in French as a moderator on that hand as well. So again, thanks everyone for being here. Reach out on LinkedIn if you have any questions. See DRI Canada's website, see the Canadian Journal of Emergency Management website, look at the resources available, and feel free to reach out. And this is my opening to all the panelists on LinkedIn. I'm sure they'll get back to you with any answers to your questions you might have as we continue to foster the rhetoric and discourse for emergency management, business continuity, and disaster response in Canada. And that is where I will end it for today. Thank you for being here.